Good afternoon, this is Dr. Walker again, and thanks for listening in. I'm going to do a quick little talk today about my experience, if you would, in getting an MMR vaccine. So, some discussion among people that I know essentially asking, am I an anti-vax person? And I'm clearly not an anti-vax person, but again, I'm very serious about what I put in my body. Um, um, just for safety purposes, I need to know what's happening, what's going in my body, just to be on the safe side of things. So again, not an anti-vax person. Again, just want to be certain what I'm doing. I've had multiple vaccines. I've had, the flu shot every year. I'm looking at my record here from 20, 14, 15, 16, 17, 18, 19. Just some periods there. I've had that's TB. I've had that as well. Uh, let's see. Also had tetanus in 2007. TB again. Again, just a litany of things that I've had done in the past, and I'm comfortable with those. I've had my MMR vaccine in on the 1st of March 2021. And the reason I did that, I'll let you know, was that there was some discussion that I read, or some things that I read regarding people in American Samoa and Madagascar and those kind of places that, had essentially no record of COVID-19 for several months into the pandemic. I think for American Samoa, for example, they had no known death or disease documented from COVID-19 late 2020, no documented. So anyway, I thought about that, and I didn't mind the MMR vaccine because it's been around for a long time. I had my first dose in 1985, dating myself there, and again had no problems with it. So I knew for me it was safe, and I knew it's been around since probably the late 50s, 60s. I think it's in the 60s it came out. And that it had, I've not heard of any major complications with the MMR vaccine. So I looked into getting it done. But the funny part of that was I got there, and my providers are asking me about, what about the COVID vaccine? I said, well, I'm going to give myself some time just to see how things, pan out, because I've, been reading things then about clots in your legs and pulmonary embolism, and people with anaphylaxis, and obviously subsequently I've heard other things to include, people with thrombus, for example, in their cerebral veins in their heads. I've done a video on that as well. But so again, I know the numbers are few. I think the numbers then were like one person in 1.2 mil that would get cerebral vein thrombus. Again, the number is small unless you were the individual who obviously have that thrombus. So I was, I knew about some of the risks and so forth. And again, just want to say that the vaccines do exactly what they're supposed to do. They're not, the vaccines do not say that you will not get COVID, but what it does say is that if you were to get COVID, your chance of hospitalization and risk of death diminishes significantly, which that's what it does. That's what it says, and that, as far as I know, is true. But the whole saga, though, of me getting the vaccine was interesting. So first, it was lots of questions about why not just go straight to the COVID-19 vaccine. Gave them my reasons. And then the next part of the discussion was, well, let's go ahead and test your blood, your levels, to see if you've had antibodies, essentially, antibodies against the measles, mumps, and rubella. I should say that before, to see if I had antibodies. And so, fine. So they drew my blood, and I had antibodies. And so they said, well, yeah, if you have antibodies against essentially all three of those, then there was no point in giving you that vaccine again. I said, well, it's been since 1985, and I know it's supposed to be a lifelong immunity, true, but it's been since 1985, and so I thought some of that protection would have waned. Apparently, there's a cross coverage between mumps, for example, and COVID-19. It's a small cross coverage area, but it's, from what I read, it offers some protection, and so that's why I did it. The point was I did not know exactly what my levels were, and so I went back to them to say, listen, this could be, yes, it's positive, but it could be, somewhere in, positive close to 1 versus positive close to, a certain level of, let's say, I don't know, 30. So I wasn't quite happy with the fact that it did not give me a level. So then I had to go back and get it done a second time, just to get the vaccine. And a blood drawn a second time, and somehow the discussion wasn't quite clear regarding what the intent was for the second blood draw. So again, the second time it just said I was positive, which again I'm not happy with that because I need to know what my levels were at the time. Anyway, my provider then said, you know what, let's go and just give you the vaccine and call it a day, call it quits. Now, and I was happy with that. Now, that's my understanding about vaccines, especially as an adult. If you've had been exposed already to the antigen, if you had immunity, there's no point in giving you additional vaccines because you've already had the immunity. Again, if you've not had it, then that's one conversation. But I'm talking about folks who've had the antigen exposure already. Hence, you should have some kind of immunity, whether it be serum immunity or B or T cell immunity. You should have something in your system. And so that's my understanding of vaccine. So it makes me a little concerned, anxious, I guess, perhaps, where I see people coming back to work who've been out because of COVID, and then the next thing they're doing is they're getting the vaccine. And again, that's the individual's right. Obviously, I get that. I just don't understand, because most things that we know of, most antigens that we know of, your body gives you a pretty robust, if you have immunity, a pretty robust immunity. And I don't know yet, and I could be wrong. If I'm wrong, let me know. For example, the measles vaccine, for example. If you've had measles, typically your antibody levels are 3 times more robust, for example, than the vaccine. That's a point of fact, right? It's typically more robust. So in that same language, that same idea, if you've had COVID, your response should be robust to some degree. Now, the vaccine works, again, based on, take my hand, for example. My hand was the antigen, the thing that your body's going to protect you, fight against. The vaccine sort of targets these receptor sites, if you would, the tips of the spikes of the protein, if you would. It attacks that area. Now, if you have had the antigen or the virus itself, your body's going to create a response again, not just the spike part of that. It's going to create a response against the entire thing. So all surfaces of that protein, the body will see it as a problem and create a response against that. So I'm not quite sure then how, if you are creating a vaccine against the spike section, how that is going to be somewhat better than, let's say, you having had the antigen presented to your body by itself. My point is that I think that, and again I could be wrong, that your response, your own natural immune response should be pretty profound, unless, again, you have a weakened immune system. And regardless, though, if you had a weakened immune system, the vaccine still should not, in my understanding, should not give you a better response than the actual antigen itself. So it's just my question. But I know what I went through just to get the MMR vaccine itself. Based on what I know, lots of question about why do you need to have a vaccine. Again, if you already had immunity, if you had immunity already against MMR or measles, why would you need to have the vaccine? Again, I just pose that question again regarding the COVID-19 vaccine. If you've had COVID, then how then is the vaccine any additional benefit? I'm not quite sure what the response is for that. Anyway, that's my thought. If you've, and talk with your doctor, maybe they have some additional information regarding it for you. But as far as I know, when you've had the natural immunity, vaccine should not offer you any more protection than the natural immunity. Now, if you've not had COVID, if you've not had measles, mumps, rubella, if you've not had them, yes, the vaccine would probably offer you some protection. I get that. But on that same note, just remember the COVID-19 vaccine does not protect you from getting the virus itself, right? It does decrease hospitalization, but it does not stop you from getting COVID-19. Um, on that note, my little pitch again is going to be for vitamin D. Vitamin D, I think, is a profoundly underestimated vitamin or hormone, as some people would say, that I suspect offer you a significant amount of assistance from an immunity standpoint that help your system generate protection against not just COVID. I think against any kind of infection, whether it be bacterial or fungal or viral. It offers you some underlying immune protection. And again, I've asked this question. There was someone that made a joke at my table. We have a discussion on Fridays, sort of a department meeting, and someone mentioned last week to me that they read an article that said 98.9% of people who were hospitalized for COVID did not have the vaccine. So in other words, people who are not immunized against COVID with the vaccine, they were the ones who were in the hospital. And I fully understand that, and I get that, and I think that's a very good point. I also lend, though, that I would like to know what the vitamin D levels of those individuals in the hospital, because I suspect that probably 100% of those folks did not have adequate vitamin D levels. Again, I take 5,000 units myself every day. Don't take what I take. Talk with your doctor to see exactly what your levels are, and then determine then what amount you should take per day for yourself. But just, until you have the vaccine, until you're certain that the vaccine is safe for you, definitely, if you do nothing else, jump on that on vitamin D. And again, for me, vitamin D, zinc, quercetin, vitamin C are important. Anyway, thanks for listening. Dr. Walker.